So I think human connection was impacted in the last 10 years. I also think that young people, especially, not to make myself feel old, but young people are just around so much information, stimulation, and I think we are starting to see the effects of that. So 10 years ago, the TikToks, the Instagrams, the Facebooks, they're not what they are today.
Exactly,
right?
exactly.
When I say clinical provider, we're talking about somebody who's a psychotherapist, a psychologist, a psychiatrist. What do these all mean? A psychotherapist is a counselor. There's someone who's going to talk to you. They're going to converse with you about your thoughts, your feelings, your emotions through different techniques, which are through cognitive behavioral therapy or dialectical behavioral therapy, which are just different ways to understand your feelings, your thoughts, and to process them and to develop skills to redirect them, to get through them, to work through them. Even for trauma patients, counseling is there. So counseling, psychotherapy is talk therapy. A psychologist is a doctor, right, a PhD, but a psychologist will go into a further assessment or an evaluation to really go on a deeper psychological level of what exactly you are dealing with from a diagnosis standpoint as well.
Okay.
So a counselor can give you a diagnosis, a psychologist can give you a diagnosis, but the difference is you're going into a deeper level of what we would call the clinical psychology. So you are going through an assessment and evaluation, multiple levels of testing, so it's very in-depth. A psychiatrist, which is where my background falls into, is more somebody who does some element of psychotherapy and psychology, but I'm prescribing you a medication.
Okay. So psychologists can't prescribe you any medication?
They don't prescribe medications, no.
They work only on the behavior of the person,
behavioral component,
the patterns like which person is having, and then working on those.
But see, they can also work with you on your medication discussion that, if your psychiatrist prescribes you something, a psychologist can assess how that person's responding to it. So further follow-up and an assessment can tell you this, my psychologist told me that I'm doing better because my psychiatrist started me on the medication. There needs to be more of that collaborative care in a perfect world.